Welcome back, viewers at home. You're still tuned in right here on INX Prime Channel 345. You're about to join me for a conversation that will leave you informed and definitely fulfilled in understanding the different spheres and different things that are done within the healthcare system that are actually even improved by the likes of my guest this evening, who goes by the name of Nomfundo Khabela. Now, Nomfundo Khabela is a distinguished healthcare leader with over 2 decades of experience in the pharmaceutical and health tech center. Now, for more in understanding the work that she does and the many things that she's been a part of, good evening and welcome to INX Prime.
Thank you so much. Thank you for having me.
Now, before we get into the work that you do, I think it's fair enough for us to just get to understand from your view in terms of what work do you do, as well as what really inspired you to now dedicating to improving healthcare in Africa.
Sure, that's a great question. So, I mean, if I start at the very beginning, I am a nutritionist by training. Went straight into the pharmaceutical industry because of my passion for nutrition, because of healthcare in general, to be very honest, and because of my really wanting to make a big difference in people's lives. Spent 20 years within the healthcare industry, and in those 20 years, began to realize that there's a lot more to healthcare than just the clinical aspects of it. There's a lot that happens in the background, which is really where health tech sits. It really kind of, if you think about it, is the bedrock or the foundation that supports the clinical layer of healthcare. And the role that I'm currently in is with an organization called HealthBridge. And what we do in that organization is that initially we started by allowing communication between healthcare providers and funders. We create, or we are that architecture or that vehicle for communication on claims. So for instance, if you go to your doctor today or you go to a hospital, they need some way of submitting that claim information to the funder in order to recuperate any costs that they may have incurred within that process. So without that architecture that we provide, it is very difficult for the two to communicate. So off the back of that, very successful first to market, architecture, we then evolved into cloud-based electronic medical record systems, as well as practice management systems. So, the industry is really evolving towards digitization. And it's a really great time and place to be currently within the healthcare industry because of that transition globally as well as locally. So that's really what's informed my migration from, lowly nutrition to the big pharma world and now into health tech.
Amazing. Now, seeing that you are in the health tech industry, can you just quickly give us a brief understanding in terms of what role does that play in, ensuring that value-based healthcare is provided? And I think you can just help us by understanding, the term value-based healthcare. What does it even look like?
Sure, it's a great question. So my passion is value-based healthcare. So to explain what value-based healthcare is, I'd have to explain what reimbursement model we live in now. So currently, predominantly, globally, we use the fee-for-service model, which means if you're a patient and you're seeking healthcare services and I can provide those, you would come to me as Dr. Nomfundo, and I would bill you for that time or for that service, whatever that value is. And then you would claim that from your medical aid and they would reimburse me whatever. If you're cash paying, you would pay me directly, or, the arrangement with medical aid. So that is literally, it's a volume-based system. A doctor earns more money by seeing more patients. Correct. A hospital makes more money by filling more beds. It's volume-based, okay? So that's currently what's used globally. Value-based healthcare really turns that on its head and says, okay, healthcare professional and hospital, you get paid for your services, but who's looking after the patient's total cost of care? Who's looking after the patient's healthcare outcomes? Nobody is incentivized currently under the fee-for-service model for really taking care of those two really important dimensions of healthcare. So value-based healthcare is really that new reimbursement model that says, as a healthcare professional, as a hospital, any kind of healthcare provider, you are justified to bill for your time. It's your expertise, it's your services. But what we are going to pay you on are new parameters. It's going to be around the total cost of care, reducing it for the patient, right? Because right now healthcare costs are spiraling. In South Africa, globally, private healthcare is becoming unaffordable. And we're seeing that in how the member base in medical aid or medical scheme members is actually shrinking. People are falling out because they just can't afford medical aid rates. They're buying down into cheaper schemes, or they're buying into these new products like medical insurance or health insurance, et cetera, which are cheaper but allow you access to good quality care. And that number is growing because it's more affordable. So again, value-based care now incentivizes providers on lowering or reducing the total cost of care, and that's the total cost, not just episodic care, like you come to me once. It's if you're a diabetic for the entire existence of your condition, we need to make sure that that total cost of care for that condition that you have is brought down relative to what it is today. And on top of that, an additional KPI is patient outcomes. How does the patient feel about the service or the quality of care that they have received? Because that's what really matters. It's turning patients into consumers and wrapping healthcare around the patient, as opposed to what it's been all along, where the patient walks into this very fragmented healthcare system. I don't know if you've ever had, I don't know if it's the most fortunate, but if you've ever had the experience of going through the healthcare system, let's say you need surgery, or you're taking a parent through or a child, to understand or to navigate from when the doctor sends you to a specialist, the specialist books you into a hospital, you really don't know what's going on in that environment. Yeah. You feel very lost, there's very little information, and that's because the healthcare system forces the patient to navigate the system and not the system to wrap itself around the patient.
That is quite beautiful, and I think not to sound like I'm asking you a no-brainer question, but I want to know, why is your focus particularly in Africa? Because, when we're hearing the ideas of how volume-based the healthcare system is, people from the West will say this, will have the same conversation. But to you, why Africa in question?
Sure. Absolutely. The healthcare sector across the globe struggle with the same issues. High cost of healthcare, and it's continuing to just get higher every single year, as well as the fact that patient outcomes really aren't taken care of. Really, the quality of care isn't being accounted for from a patient perspective. However, what makes Africa unique is the fact that we sit with very large disparities between public healthcare and private healthcare. Your global north countries sit with universal healthcare coverage systems like your NHS, etc., or Medicare in the United States. We are sitting with South Africa probably being the first to really establish a universal healthcare system that has value-based care embedded into it. So it's really around the fact that we sit with such high disparities, such fractured healthcare systems, and we're just a lot further than our global north partners. And that's why my passion is for Africa and the fact that I live on this continent, so my investment would be in this continent.
Now, I know that you have a background in nutrition, and I just want you to help us understand some of the challenges faced by, because when we talk about healthcare, it's a reflection of how sick or healthy the society or the nation is. And I think healthy or health comes from the lifestyle in terms of what we're consuming and everything around it. Now, how would you best comment on some of the challenges that are within the African continent when it comes to their nutrition, and how can they actually change that into something positive that works for them?
Sure, it's a big question.
Sorry for that.
No, it's fine. It's a great question. I love it. To your point, nutrition really underpins all lifestyle diseases. We're speaking, your non-communicable diseases, which we know are growing at such a fast rate within the African continent. It's correlated with the rate of urbanization. Now, the issue there is that there is now access to foods that weren't traditionally available. More people are now working outside of the home or outside of kind of an agrarian environment and are now earning more money to be able to afford these new modern foods, right? Your fast food type foods. And because there's a lot of miseducation or misinformation around nutrition and just the basics, right? That's where we're getting it wrong. We aren't educated, and it's I think there are a group of people who do have the information but choose to ignore it. Yeah. But I do really believe that there's a group of people who are what I would call nutritionally illiterate. They don't understand the impact of food on their bodies. And I do believe that there needs to be a lot of intentionality, again, going back to value-based care, because if we're looking at bringing down the cost of the total cost of care over the full duration of a patient's life, you're going to have to really be intentional about educating patients about their own health, about taking charge for themselves, because an educated patient is an engaged patient. An engaged patient is a healthier, more committed patient. So government and health institutions and practitioners are really going to have to invest a lot more time explaining the basics of healthcare and nutrition being at the center.
Now, unfortunately, we've run out of time. I had so many questions to ask you because this is quite a very important question. Because when you look at the likes of high blood, we look at the likes of diabetes. I mean, not so long ago, I was listening to a podcast that was looking into, our skin, but how it's easily, deformed by what we consume, like the likes of sugar and so forth, and pollution itself. Now, for someone like yourself with a very beautiful background in nutrition as well as, health tech, I want to know from you, how do you plan, or what approaches do you implement in terms of getting rid of that volume-based healthcare system to now bringing in a very smooth transitioning way, the value-added healthcare system?
It's a great question. I mean, it's a very iterative process, right? Because healthcare is such an established industry, and it's also a very delicate industry because of the type of information that we work with. So in terms of what we're doing as an organization is that we are providing a platform where doctors can take those yellow folders that you get, those patient files, and digitize them. And when you digitize information, you make it more readily available. You open up access to healthcare by allowing patients to access doctors virtually. So that's the first thing. We're allowing virtual consultations, which are cheaper, and which means that a patient who's sitting in a very remote area or doesn't have the affordability of being able to travel can use their smartphone and get good quality healthcare. And then on top of that, we're then using the data that the doctor then adds onto that system, that new yellow folder, that digital yellow folder, to be able to track the patient's medical history easier. It's easier to read a graph than it is to read a series of notes over several pages, because then I'd be able to see how you are progressing in terms of your diabetes when it's digitized. I'd be able to document things around your nutrition. I'd be able to then look at it from a population perspective and really drill into that information to improve my health systems, to improve the programs that I then apply to the population of patients that I'm responsible for.
Nomfundo, this was quite a beautiful conversation, and with your permission, I pray and hope we can have you back, because I think we would like to share with our viewers at home on how we can foster a more culture of collaboration and knowledge sharing, and also how we can, have sustainable ways that allow us to use what we have to, best serve us. But thank you so much for joining us this evening.
Thank you so much for having me.
Viewers at home, that was quite an amazing, positive, uplifting conversation between myself and Nomfundo. Trust you me, we're going to try and beg her and plead with her to come back for more, because unfortunately we've run out of time. But on that note, let's head over to an ad break. See you when we come back.